measures like the $24 billion package. And not only that, this will cover 800 million individuals as food ration during the difficult times, and cash transfers to 204 million women. And of course, 80 million households will also benefit for the next months from getting free cooking gas. That's the kind of support we said it should be given. So we should not see it from the public health part alone, but see it from the angle of what the consequences of these public health measures will be on the community, and try to support our citizens. And this should be seen during these difficult times, during the lockdowns as so-called, and that's how we can get the best impact, but at the same time cooperation from our communities too, because if we understand and try to help them. But there was another important element I mentioned in my presser today, because it's very important, I'll repeat it. Many countries, many developing countries, cannot really support their society, especially during lockdown, especially on those community members who work for their daily breads. And that's why we called on the international community to have a debt relief to support those countries. But as you also know, debt relief processes are actually lengthy. But what we're proposing together with the World Bank and IMF is an expedited process to support countries so their economy will not be getting into crisis and their communities will not be really getting into crisis. This is a time when we need solidarity, not only for public health, but also to address the economic and social challenges that many countries are facing as we speak. I will repeat with what I started. This is a pandemic for the first time caused by a coronavirus and whose behavior is not really known, and we have to stand in unison to fight this unknown and dangerous virus.
Just wanted to supplement with what Mike and Dr. Tedros has said. And one of the things that we are working very hard on is to systematically assess the response actions that are being taken by countries. As Dr. Tedros has just said, this is the first pandemic of a coronavirus, and it's important for us to critically look at what countries are doing so that we can assess these and see which actions have worked best and which combination of these have worked best. And there's a lot of factors that go into this that relate to this comprehensive approach that we've been talking about. So, for example, what are the testing strategies that countries are using, and what is the percent positive that they're seeing in terms of the numbers of tests that they've done? What is their surveillance strategy? How are countries looking for cases? Are they looking at suspect cases and contacts? Are they trying to identify additional cases through existing respiratory disease surveillance systems like their ILI or their SARI surveillance systems? How are the public measures being applied, and when and where? What movement restrictions are put in place, when and where and for how long? How are our governments and leaders communicating with their populations, with their people? What type of support is being provided to communities? And how are we innovating? And how are we conducting research to learn and feed that back into the response? All of those things need to be done at a national level and at subnational levels to look and see which actions are the most effective. We have evidence from Asia in terms of a number of countries now that have broken this down to subnational levels to look at what has been done where. And what we've been saying about aggressively looking for cases, testing suspect cases, finding contacts, quarantining contacts, isolating patients, and caring for them depending on their severity, those work. But we also need to continually assess what is being done as this pandemic moves across the globe so that we can build up that evidence base to show what works and to make sure that countries have a tailored approach to their response.
Thank you very much. From India, we will move to Scotland. Anthony from The Gaudi. Anthony, can you hear us?
I can. Can you hear me?
Yes, please go ahead.
Great. So I'm Anthony Newman from The Gaudi newspaper. Because of the pandemic, millions of students around the world have had to put their studies on hold. Could you elaborate on what the WHO and national governments can do to aid students and educational institutions at this very difficult time? Thank you.
Well, first of all, we thank all the medical, nursing, physiotherapy and other educational institutions around the world who've done such a fine job turning out such wonderful professionals who can come and help on the front line in so many countries. Clearly, we thank them, those institutions and those individuals who are stepping forward to volunteer, but we also have to be sure that those individuals are protected, that they're doing work that they're well trained and qualified to do, they're well supervised, and that they actually can assist and add to the value of the response. So we have a duty of care to them and a duty of care to the patients to ensure that we're given the best possible care and we're using pre-qualified professionals in any part of the medical system are doing work that they're capable of doing and supervised in doing. It's also obviously very important that at some point that these students, particularly the ones who are near final exams, have the opportunity to qualify and get into the system. And I'm sure that national medical, nursing and other educational policies are being adjusted and adapted to see how that can be achieved. And will pass to Maria if she has any further points on this matter. But we will certainly be happy to work with national governments and with national medical, nursing and other educational institutes to see if we can come up with rational policies to guide the completion of education for many, particularly late-stage students in the medical professions.
Thank you very much, Dr. Ryan. We will now go to Russia. Anna Redkina from Russia 24. Anna, can you hear us?
Yes, I can hear you. Can you hear me?
Yes, please go ahead.
Yeah. Hi, thank you very much for taking my question. Here in Russia, we see a sharp rise in the local wholesale and retail prices of ginger. Could you please clarify whether ginger can really help to prevent or treat the new coronavirus, or is it just a myth?
I think we have to be careful from what we would consider to be the traditional remedies that people use for making themselves feel better during a common cold or the flu or any illness. We've all had illnesses, and some of us like to take a drink with honey, some like to take ginger, some of us take special herbal teas. Anything that makes one feel better, anything that provides that reassurance, and anything that you believe can help your health that's not dangerous, certainly has a positive impact on your health. But it's a different thing to say that something is effective in treating the disease. At this moment, there is no therapy that has been proven to be effective in the treatment of COVID-19. We've explained, and the DG has explained actually earlier, about the Solidarity trials and many other trials that are testing many, many different compounds around the world, including the ones that are most promising. So I would advise people that if you have your favourite remedy that you use, like honey, like lemon, like ginger, please continue to support yourself through the illness. But please let us avoid making assumptions without evidence that certain things can cure COVID-19. At the moment, there is no proven therapy for COVID-19. Maria?
Thank you very much. That was Russia 24. Now we will go to Karen Wolfson. From a World Health Alert Crisis, Karen was with us almost every press conference, so we are happy to hear from her now. Karen, please go ahead.
Good afternoon, good morning, and good evening. I'd like to ask how can individuals be persuaded that COVID-19 is a real threat and what each person does makes a difference? Some people still don't understand that if they fail to follow the physical distancing rules, they could be infecting other people that may lead to deaths further down the line. Or is it a case that some individuals need to be persuaded that what happens in their community as a whole is really important, and that a greater sense of local community needs to be established in order for them to take on physical distancing? That's my question.
So thank you for that question. I think you almost answered the question in your question, in the sense that COVID-19 is a real threat. It is a real threat to everyone on the planet. It's a new virus, which means everyone is susceptible to infection. It is a virus that causes disease in people, which range from some individuals will have mild disease, and a large proportion, 15%, will have severe disease, another 5% will have critical disease, and some people will die. So many individuals who will develop severe disease are older, but we have seen in a number of countries that younger people are dying. I'm looking at data from Italy here, and we have individuals in their 30s who are dying. We have individuals in their 40s, in their 50s who are dying. This is a virus that can be very serious in individuals, and so it's a real threat. It not only has public health implications, but it has very strong social and economic implications. And everyone needs to understand that they have a role to play. Every person has a role to play in this pandemic, and a sense of duty to ensure that they take every precaution that they can to protect themselves from getting infected. And we've listed a number of ways in which people can protect themselves through hand hygiene and respiratory etiquette, through physical distancing, by removing opportunities for yourself to get infected. If you can prevent yourself from getting infected, you could prevent onward transmission to someone who may be more vulnerable, who could develop more severe disease and die. And that is a responsibility that you have to yourself, to protect your family, and to protect your community and your loved ones. And that is something that everybody needs to understand. Every person on the planet has a role to play here, and they need to feel empowered to be able to do something about that, to protect themselves.
Thank you very much for that. We have a time really for one or two more questions, so we will go to Nigeria now, to Innocent Eneta from MetroStar newspaper in Nigeria. Innocent, can you hear us?
I can hear you. Good evening, sir.
Please go ahead, we can hear you.
Okay, my question is this. We landed about 500 ventilators in Lagos, in Nigeria particularly. And there's a lockdown in Lagos, Abuja, and Ogun states. Presently, the people in Lagos are feeling the impact of the lockdown within 2 days that they are thinking of protests. What has WHO given to Nigerian government as a guidance to manage this situation on ground, especially now that we have a lockdown in Lagos, Abuja, and Ogun states, knowing we have less ventilators in this country? Thank you.
The line wasn't the best, but my understanding that the question is how WHO is helping Nigeria in terms of medical supplies.
We've been working very closely with Nigeria since the beginning, and particularly with the Ministry of Health and Nigeria CDC. In fact, the Director General and myself spoke with the Director of Nigeria CDC. Latest was this morning with Chikwe Ike, Wezu, and actually we're reviewing our support to Nigeria and what more we could do. We have been supporting lab diagnostics, we have been supporting with the creation of isolation facilities. We have actually been in Nigeria supporting Chikwe and his teams and the